Is it true if you drank urine, you could tell if somebody was diabetic? Bizarre fecal fossils, grandma's mysterious eggs, and drinking urine tests for what now? Today we're diving into the weird, the wild, and the downright odd medical curiosities, one question at a time. All right, let's dive right in. New fear unlocked. What the heck is a fucaloma? Hope nobody ever has to experience this, but a fucaloma is basically a hard-shelled poop ball in your intestines. Basically what ends up happening is if you are constipated or you have slow gut motility or another reason why stool is not moving well and it's just sitting in the colon over a very, very long period of time, it can actually become hardened and encased and could cause bowel obstructions, a lot of pain. Might mean that you need to get it removed. And sometimes we do manual disimpaction. A doctor will stick their hand up that side and pull it out. What happens if you eat poison ivy? I know it harms your skin, but what happens if you eat it?
Then I said, don't do that, do something else.
So we know poison ivy can cause that reaction to our skin where it swells, it's inflamed, it actually oozes open and it's irritating to that area. It can actually do the same thing to the inside. So meaning the mouth, the tongue, the throat, all can get swollen, irritated, red, and the concern is that it can actually include your airway or cause enough inflammation that it closes your airway or an allergic reaction, all things bad. If a significant amount of brain tissue gets removed, do you lose intelligence? So that's a really good question. It all depends on what area of the brain that you are removing. Are you removing the specific part of the brain relating to memories, thought? Then yes, it's going to be massively affected. There are other parts of your brain, such as the cerebellum, that have to do with like balance and coordination. So you wouldn't lose intelligence, you might lose balance and coordination. So it all depends, but they actually do have studies and know individuals that have had a hemispherectomies, basically where they remove or don't have the whole one side of their brain and they're actually able to pretty much function really well. What actually is a coma? So by definition, a coma is a prolonged state of unconsciousness that's not sleeping. You're unconscious, you're not aware, but you're still having some brainwave activity. Because if you didn't have any brainwave activity, then you would be brain dead. How does one end up in that situation? Trauma, infection, strokes. Usually individuals don't wake up to sound, light, painful stimuli. Then you might follow this up and say, okay, what is a medically induced coma? So it's not just a sedative, it is putting a person in a state of unconsciousness where they would not respond as if you were in a regular coma. And the reason why doctors would do this would have to do with the benefit of the individual, slowing the brainwave activity down, decreasing its function, maybe helping it from swelling. I've heard of testicular torsion, but can females get an ovarian torsion? Oh yes, a testicular torsion and an ovarian torsion are horrifically painful. And it's because they are twisting, and what ends up happening is you're decreasing the blood supply to that organ, which then causes a significant amount of pain. You think about it, you put a tourniquet on somebody's arm, it is extremely painful. So it's the same idea. You have a twisting of the ovary, usually around the ligament itself for a multitude of reasons, and it's a surgical emergency. You're decreasing blood flow to an organ and you need to get to it fast to untorse it or detorse it to allow blood flow. And if you can't and the tissue then dies, you need to get that tissue out of the body because it's going to start necrosing. Can a skunk spraying on you create an allergic reaction and cause anaphylactic shock? Yes, but very rarely. We can have an allergic reaction to pretty much anything. I know individuals that have an allergic reaction to cold, to the sun. An allergy or an anaphylactic reaction is basically your own body response to an allergen, basically, or something foreign. And it's its over response relating to IgE, which is a type of antibody, which then activates a mast cell, which then breaks down histamine. And the histamine is what causes the hives, the redness, the vasodilation, the swelling, causing this big massive issue. Are you guys allergic to anything more uncommon like skunk spray? Let me know in the comments. Why do I get mad and irritated when people chew or sneeze near me? It's worse than nails on a chalkboard, I swear. Well, my friends, welcome to the Misophonia Club. It is a condition and common condition where sound actually triggers an emotional response. Anger, irritation. It is very real, and people will say it's in your head. Well, it actually is. It's related to your amygdala. It's your body's reaction, almost like a fight or flight response to these sounds in an emotional way. Why does your nose run but feet smell? Your nose runs, right, because it's dripping of the mucus that is in there that is actually protecting us. That's binding to all the badness in the air and getting it out of our body. The nose is the humidifier plus filter. And then our feet smell because of the specific glands that are down there. Hopefully you are doing things to prevent your feet from smelling, making sure you clean your shoes, change your socks, and make sure your feet are dry. Those are the simple things that you can do to reduce how smelly your feet are. If you do end up having significant malodorous sweating going on in different areas of your body, you can actually see a doctor and be evaluated for a rare condition relating to that, and there are ways that a doctor can help. If you took medicine with soda accidentally instead of water, would it be dangerous or would it actually dissolve the medication? That's actually pretty interesting and good question, but probably doesn't change much, but because you have to think about your stomach acids. Your stomach acid, the pH, is much lower than soda. So the stomach actually will be breaking it down pretty quickly, but it then takes time for that to get absorbed into our bloodstream. I would advise staying away from the soda. Water, that's what we need. We're made up of water. Drink the water. Why does the mere mention of yawning trigger yawning? Just yawn 3 times in a row because of that question and in typing this out. Yawning helps regulate our brain temperature as well as more alertness. So maybe that is why. It's contagious because of something called the mirror neuron reaction. And this basically is imprinted within us to have this normal reaction. If somebody else yawns, are basically coded to yawn as well. And speaking of yawns and sleep, if stress, snoring, or too many bizarre ER thoughts are messing with your sleep, Do Not Disturb from Life Happens could be your new bedtime best friend. Get some peace and quiet at lifehappens.com or Amazon. Plastic versus aluminum, which is worse? Can you get aluminum poisoning from drinking out of sparkling water cans? Plastic bottles. We hear about it in the news, the microplastics. The plastics can potentially break down. They're also chemicals. And so it breaks down in small pieces or even just exposure to sun and light. So aluminum, on the flip side, you would think might be healthier from the plastic standpoint, but they're coated with plastic on the inside to prevent the aluminum from leaching into the drink that you're trying to enjoy. Is it true if you drank urine, you could tell if somebody was diabetic? Back in the day, yes, we don't drink anybody's urine nowadays, but we detect glucose in urine. Back in the day, doctors actually drank patients' urine to see if there was sweetness to it, which would then indicate that there was extra sugar in the urine, which then indicate the patient has diabetes. And that is where the name came from, diabetes mellitus, which basically means sweet siphon. Please don't drink your urine. Hey doc, I have a question. My mother said that I fell from a stroller on the right side of my head when I was a baby, and years later I feel a bump on that side. Is it possible that it's from falling off that stroller? Yes, it could be, because when we're younger we have softer skulls and the bones are forming. It could be a couple different reasons why that might happen. The bones could break or fracture, and then you have a bigger, robust response to building bone on that area. It might have gotten displaced and resealed or healed itself in a crossover position. What would happen to someone if they smoked 200 cigarettes a day? That is a beeline fast track to the ICU to mortality. And that's how we actually refer to it in medicine when we say, okay, your 1 pack or a 2 pack year history basically. So how many you're smoking per day? This is 10. That's not good. We know that there is a direct link of cancer to smoking cigarettes. The more you smoke, the higher your chances of abnormalities happening. So please don't do that. Females are born with all their eggs at birth. So at one point in time, was someone's mother potentially carrying their grandchild? So think about this. This is a really good thought-provoking question. Patient gets pregnant. Baby is in the womb. That baby is developing all the eggs that she will ever have if it is a female. So when grandma was pregnant with your mom had all her eggs at that point, and one of those eggs became you. If you have any other unique medical things like that, let me know in the comments. And of course, if you guys enjoyed all these questions and my responses, definitely check out this playlist right here and continue to send those questions to us. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.